and welcome to Time with Lydia, the pharmacist. Our topic today is pulmonary embolism, and we are going to explore what pulmonary embolism is, the signs and symptoms of pulmonary embolism, who is at risk of developing pulmonary embolism, and how to prevent pulmonary embolism, especially when traveling. Pulmonary embolism is also known as PE, and it is a blood clot that blocks and stops blood flow to an artery in the lungs. In most cases, the blood clot starts in a vein in the legs and then travels to the lungs. When a blood clot forms in one or more of the deep veins in the body, it is known as deep vein thrombosis. PE can be life-threatening because there is a blockage of blood flow in an artery of the lungs. So it is very important that we are all aware of the signs and symptoms so we can prevent any complications from happening. Because PE is treatable, and when it is caught early, it can easily be treated. It is preventable as well, and there are ways that we can prevent it from happening. The symptoms of pulmonary embolism can vary greatly depending on how much of your lung is involved, the size of the blood clot, and whether you have any underlying lungs or heart condition. Now let's talk about the signs and symptoms. One of the commonest is shortness of breath, and this appears suddenly. You will have difficulty in catching your breath even when resting, and it will get worse with physical activity. There can also be chest pain, and this will feel like you're having a heart attack. The pain is often sharp and felt when you breathe in deeply, and you will feel it when you cough, bend, or lean over. And because of the intensity of the pain, you will try to even avoid breathing in deeply. Pulmonary embolism can also make you pass out when your blood pressure or your blood rate drops suddenly. Other symptoms may include a cough that may have some blood in it, a rapid or irregular heartbeat, lightheadedness or dizziness, excessive sweating, a fever, leg pain or swelling, or both, usually in the back of the lower leg. Pulmonary embolism can be life-threatening, so it is very important that anytime you start experiencing any of these symptoms, you seek urgent medical attention. Now, who is at risk of developing pulmonary embolism? Blood clots are more likely to form during prolonged inactivity. For example, when you're confined to bed for an extended period after a surgery, after a heart attack, after a leg fracture, a trauma, or any serious illness that prevents you from moving. All these can put you at risk of developing a blood clot. Now, this is how it happens. When your legs lie flat for a long period of time, the flow of blood through your veins can slow down and blood can pool in your leg. This sometimes can result in a blood clot forming. Now, another risk factor is when you take long trips. And this would occur when you sit in the same position for a lengthy period during a plane or car trip. This slows blood flow in your legs and can put you at risk of developing a blood clot. Other risk factors include smoking, being overweight, especially when you have other underlying conditions like a lung problem or a heart disease. Also, when you take supplementary estrogen, such as a birth control pill or a hormone replacement therapy during menopause. Pregnancy can also put you at risk of developing a blood clot. Being diabetic or having cancer, as well as being over 60, can all put you at risk of developing a blood clot. Now let's talk about some preventive measures. It is very possible to prevent a blood clot from developing, especially when you're traveling. You know, the risk of developing a blood clot is very low. But when there is inactivity for a prolonged period, that is when the risk increases. So it is very important that we move our body as much as we can to prevent this condition from developing. Now, when you're taking a long trip, carry out these preventive measures. The first one is to stay hydrated. Make sure you drink a lot of water. Water prevents your blood from becoming thickened. Water is the best liquid for preventing dehydration. Dehydration can cause your blood to clot. So it is advisable that we all drink and stay hydrated when we are traveling, especially for a long period. Avoid drinking alcohol, as alcohol can cause dehydration. Even if you drink alcohol, make sure you drink a lot of water to compensate for the dehydration. Another thing you can do is to take a break from sitting. Make sure you get up and move around in the airplane cabin at least every hour. And move in your seat. Raise your toes up and down every 15 to 30 minutes. And bend and move your ankles in circular movements as often as you can. Now, one other thing that you can do as well is to wear support stockings. And you can purchase support stockings in your local community pharmacy or online. Support stockings help promote circulation and fluid movement in your legs. If you're driving, make a stop at least every 1 hour and move around your car at least 2 times before you continue your trip. Other things you can do to stop pulmonary embolism is to engage in physical activity. Don't sit at one place for more than an hour. This happens especially when we're watching television. Make sure you move your body and avoid sitting for prolonged periods. If you know that you are going to be sitting or standing for a long period, get yourself a compression stockings and wear it to encourage blood flow and prevent blood clots from developing. And avoid crossing your legs. Also, make sure to maintain a healthy weight and elevate your feet as much as you can, at least 30 minutes twice a day, if that is possible for you to do. In summary, pulmonary embolism is a serious medical condition, but it is preventable and it is treatable. Quick treatment reduces the chances of death. I hope this video is beneficial. Please don't go without giving it a thumbs up. Share with your family and friends so we are all aware of this condition. Leave your comments and your questions in the comment section. If you haven't yet subscribed to this channel, please hit on that subscribe button and also on the notification bell so you don't miss any of our educative and informative content. Thank you once again for your time today, and I hope to see you soon in the next one. Bye for now.